Hi again. So I am Dr. Edna and I want to continue talking about endometriosis, but today it is going to be quite different because I want to focus on the options that our patients have when they are struggling with endometriosis and infertility. For that, first of all, they have to understand the stages and the way we classify this type of disease and the options that we have regarding that. So the first step is the classification. There are a couple of classifications regarding the stages of endometriosis. However, the most important is the one that describes how are the cells spread throughout all the pelvis and the adhesions and scars that the patients may have. So for example, in this type of classification, we can divide in 4 stages. Stage number 1 and 2 are talking about minimal to mild endometriosis. In these stages, we are not going to have endometriomas. We can have some type of adhesions, but the lesions of endometriosis are going to be very superficial. Meanwhile, if we talk about stages number 3 and 4, that is the minimal and severe endometriosis, for sure we are going to find endometriomas, adhesions that are more thinly, and a lot of spread of the cells throughout all the pelvis with superficial and a little bit more deep adhesions. Now that we have understand the classification of the endometriosis, you have to understand how we are going to be able to diagnose this pathology. Unfortunately, the symptoms of this disease are unspecific. And however, we can understand that higher stages of the pathology can denote a little bit more severe presentation of the disease. That doesn't mean that higher stages are going to give you higher and more severe symptoms. So, for example, we can have patients that are struggling with the same stage of endometriosis with different presentations. And the diagnosis of the endometriosis cannot be made by the only presentation of the symptoms. Your doctor may suspect that you have the disease and can actually give to you treatments in order to lower down your symptoms. However, you have to understand that the only way to be 100% sure that you are struggling with endometriosis is performing a laparoscopy with a special pathology test of the tissues that are going to be biopsied. Now that you have understand the stages and how we diagnose endometriosis, now we can focus on the treatments that patients have. So, for example, when we have patients with stages number 1 and 2, that is minimal to mild endometriosis, we can give our patients some kind of ovarian stimulation and IUI techniques treatments. To perform an IUI treatment, we have to give our patients control ovarian stimulation. And once we have set the timing of the ovulation, then we are going to perform an instillation of the partner's sperm inside the uterus cavity. This is going to allow us to introduce the semen, the spermatozoa, inside your body and wait around 2 weeks to perform a pregnancy test. Meanwhile, when we are struggling with stages number 3 and 4 of endometriosis, we can take advantage of assisted reproductive techniques for achieving a pregnancy. An assisted reproductive technique consists in also giving our patients ovarian stimulation treatment, but before they ovulate, we are going to retrieve the eggs from their body. Once we retrieve the eggs, we are going to fertilize them with the partner's sperm in an IVF lab. There are a couple of different techniques of fertilization process. We can choose either to do it with an IVF conventional technique, with an ICSI technique, or for example, special ones such as the PIXI, when we have a very high DNA fragmentation, for example. But once we have the ovum fertilized, then we are going to have embryos. The embryos must be developed throughout 5 days or maybe 3, and then we can going to be able to perform an embryo transfer. Once we perform the embryo transfer, you have to wait 2 weeks to find out if you are pregnant. As for the question that some of our patients ask us regarding the surgical treatment before the IVF cycles, I can tell you that not all the patients with infertility, with endometriomas and endometriosis are going to be benefit with surgeries. The cystectomy actually can give us, for example, the opportunity to reduce the pain and to be more accessible the follicles during the retrieval. But actually, performing it is not going to change the result of the process. Thank you for seeing this video. I hope that you find it helpful. Please follow us, and you are going to find out a lot of videos about infertility treatment options as well as different type of disease. And feel free to contact us if you have some questions. Remember that we are here to help you. Bye.